Hello, my name's Abby. I'm going to be your nurse today. Can you please tell me your name and date of birth?
Emily Peters, 6/15/97.
Thank you. What brought you in today, Emily?
A physical for work.
Okay, well, I'm going to be giving you a head-to-toe assessment, just working from your head down to your toes, looking for any lumps, bumps, any skin lesions, or any abnormalities. Do you have any questions?
No.
Do you need to use the restroom before we begin?
No.
Okay. I saw that the tech took your vital signs, your temperature, your pulse rate, your respiratory rate, your blood pressure, and your O2 saturation, and everything was within normal limits. Is that correct?
Yes.
Okay, great. I also saw on your way back to the room that your gait was normal. Have you had any complications with that?
No.
Okay, great. So if I had to get you to rate your pain on a scale from 0 to 10, 0 being no pain, 10 being the worst pain ever, how would you rate your pain?
0.
Okay, perfect. So the first thing I'm going to do is shine a bright light into your eyes. If I can just get you to look over my shoulder off into the distance. Okay. And then if you'll just follow the tip of my pen light with your eyes only. Perfect. And then for this part of the assessment, I'm going to have to get you to slip your mask off so I can look into your nose and your mouth. All right, open your mouth. Okay, it's pink and moist. Thank you. You can go ahead and slip that back on. So the next thing I'm going to do is go ahead and palpate your head. Have you noticed anything abnormal when washing your hair lately?
No.
Okay, great. Okay, everything feels great. All right, the next thing I'm going to do is just palpate your lymph nodes. Okay, everything feels great. Now I'm just going to have to slightly pinch your skin just to check your skin temperature. It's going to be checking your hydration status, okay? But it's not going to hurt. Okay, it was less than 5 seconds. Now I'm going to check your capillary refill. And I see that you have nail polish on, so I'm just going to press onto the top of your fingertips, okay? Okay, thank you. And I'm going to check your radial pulse. And they're even and strong. And your skin temperature is warm and dry. And if I could just have you squeeze my fingers for me. And if you can just pull and push. Great, thank you. So the next thing that I'm going to do is check your costal angle. If you just take a deep breath for me. Okay, great. Now I'm going to be listening to your heart and lung sounds. Have you ever had any problems with those?
No.
Okay. So if you'll just take a deep breath every time that I place my stethoscope on your chest, okay? Vesicular. Bronchovesicular. Vesicular. Okay, everything sounds great. Now I'm just going to be listening to your heart sound so you can just breathe normally, okay? Aortic. Pulmonic. Second pulmonic. Tricuspid. Mitral. and epigastric. Okay, I'm going to be doing the same thing, but with my bill. So again, just breathe normally. Epigastric, mitral, tricuspid, second pulmonic, pulmonic, aortic. Okay, everything sounds great. For this part of the assessment, I'm going to have you turn to the side, and I'm going to be moving to your posterior chest. So I'm just going to be looking at your spine and noting that it is straight. And if you'll just shrug your shoulders back for me, I'm going to be checking your scapula alignment and noting that they are even and symmetrical. And then I'm just assessing your skin, and there's no skin breakdown or any skin lesions or anything. And your color is appropriate for race. So again, I'm going to be listening to your lung sounds in the back, but first I'm going to go ahead and check your rib slope and chest expansion. So if you could just take a deep breath for me. Okay, great. So again, if you'll just take a deep breath every time I place my stethoscope on your back. Vesicular, bronchovesicular, vesicular, vesicular, okay, everything sounds great. So for this part of the assessment, I'm going to have you lay down. I'm going to be assessing your abdomen. Okay, Emily, when was your last bowel movement?
About an hour ago.
And the last time you urinated?
Same, about an hour ago.
Okay, great. Have you ever had any trouble or complications when going to the restroom?
No.
Okay, well, I'm gonna have to expose your abdomen. Is that okay?
Yes.
Okay, I'm gonna be looking at your skin, just making sure you don't have any skin breakdown or any skin lesions. And then I'm looking at your contour and symmetry, and then noting that your color is appropriate for your race. So I'm gonna go ahead and listen to your bowel sounds. Okay, and now I'm going to go ahead and palpate. So just let me know if you have any pain or tenderness, okay? Everything feel okay?
Mm-hmm.
Okay, great. So now I'm going to be working on your lower extremities, and I'll have to expose your legs. Is that okay?
Yes.
I'm just looking, assessing your skin, looking for any skin lesions or skin breakdown, noting that your color is appropriate for race. I'm going to check your skin temperature. It's warm and dry. I'm going to go ahead and check your dorsalis pedis pulse. And they're even and strong. And then since you do have nail polish again on your toes, I'm going to go ahead and just press the tips of your toes to check your capillary refill. And it's less than 3 seconds. Okay. And then if I can just get you to pull against my hands. and push. Okay, great. Well, the last thing I'm going to have you do is just close your eyes, and I'm going to get you to tell me where I'm touching, okay?
Okay. Upper left arm. Lower right arm. Lower foot.
Okay, great. Well, Emily, that concludes our assessment today. You can go ahead and sit up for me. Do you have any further questions for me?
No.
Okay, well, I'll go get your paperwork and try to get you out of here as soon as possible.
Okay.
Thank you for coming in today, Emily.
Thank you.